Hey guys, welcome to the podcast. I have a very special repeat guest. You guys know him and love him. Paul Ward, welcome back to the show. How are you, buddy?
Tom, I'm great. Thanks for having me back. Always a pleasure to be with you.
Dude, you're a fan favorite, man. Guys, just so you know, Paul's done this with me a couple of times. I like to make sure I invite him back regularly, but if I could, I would have him here every week. That's how good this guy is. So I'm excited.
You're too kind. I was
Yeah.
just repeating a couple of stories from some of our previous podcasts about what do I do on Monday and some of those things that stick with you.
Uh,
So I love it. And I need to thank you on behalf of all of us in field medical for the great work that you do bringing these podcasts to us. I told you so many times, but bears repeating like this is my gym time. This is my pot. When I'm walking the dog or on the treadmill. It's just so convenient, and I learned so much from it. You've done such a service to the community. I want to thank you.
Well, I could never have done this for the 5 years and 250 something episodes without amazing medical affairs leaders like you. So I am grateful for every single one of these. And I'm grateful for our sponsors too. So we do have a sponsor for this episode, our dear friends at Medical Watch. So if you guys are not familiar with Medical Watch, they will help you understand what HCPs are saying about your products and diseases on social media. It's a really important tool. Free sign up at medical.watch. I would encourage you guys to check this out. Really, really important. If you're in medical affairs, you need to sign up for Medical Watch. Just go to medical.watch. And so this episode, we're going to be talking about how medical affairs professionals should engage with digital opinion leaders or DOLs. So it all sort of ties in with our sponsor. So Paul, let's jump into it.
Sure.
This is a pretty hot topic, the DOL topic. Can you explain what a digital opinion leader is and how does that differ from like a traditional KOL?
Happy to. Let me make just a couple disclaimers before we get going,
Yeah,
and it's right in
go for
line
it.
with what you just said about our sponsor. First of all, I am not an expert in digital opinion leadership. This is something that came my way, and like most of us in medical affairs, and particularly at a leadership level, I'm having to learn as we go as to how do we interact, how do we identify what the right things to do. So you'll hear throughout some of my comments. I mean, I really do think that these third parties, like our sponsor today, can be of tremendous value in helping us all learn, identify, and interact. So really super good timing there. So the others are these views are mine and mine alone, and they do not express the opinions of B1 Medicine, where I am currently employed, and plan on being employed for a long time, as long as they'll have me, having a great time here. So my opinions are mine, and look forward to it. So when you think about the digital opinion leader, it's a digital first mentality. Like we medical has historically been very active with key opinion leaders that are mostly on the academic side, right? And we've had to evolve. We've seen that evolve into more nurse practitioners and PharmBs and PAs, and we've had to adopt and even into community as you've seen the role of medical evolve. So the digital opinion leader, very different. They can be key opinion leaders in a traditional key academic institution, but more often than not, they're not. They only about 20% overlap there from what we would consider a traditional KOL and these digital opinion leaders. But their presence is really on websites, online forums, podcasts like this, and specialty sites like Doximity and Twitter or X and the like. And so the internet has really leveled the playing field in terms of how information gets disseminated. They have a huge influence with patients and advocacy groups and caregivers. We have to be mindful of medical, like it's not just other physicians that they're talking to, although that's certainly a big part of what we're doing and how we engage. And so the other thing about the internet and the way that they're able to disseminate the knowledge and information, be it good or bad, disseminates much more quickly in this universe than it does through a peer-reviewed journal or a Congress where you're waiting months and has editorial boards and others that are looking at data. So there's a lot to keep in mind, and we're going to dig into that, I suspect here in a bit. Um, they can be very compelling. And I think, both HCPs and patients alike um, like this channel because it cuts through a lot of the noise. Like for patients, what I've heard, and when we're looking for information and scouring the landscape, um, there's no jargon. Like these guys know how to get patient and communicate with patients just like they do in their practice without all the medical jargon, if you will, that traditional KOLs have that patients sometimes don't understand or have to grab somebody in the industry or a family member that's trained to really disseminate that information and distill it into bite-sized chunks that they can understand. So really different than a key opinion leader.
Mm. Yeah, and I appreciate that explanation because I think we hear the term. A lot of people hear the term and you think you kind of know what it is, but that's a really good explanation. And I think it sets the tone for what we're going to talk about, which it leads me, it kind of answers the next question to an extent. But so why has engaging with DOLs become such an important part of medical affairs strategy? And I think you covered some of this, but I'd like to hear from you.
Yeah, I think there's more layers to that. Great question, Tom. So, I think part of it is if you really think the essence of what medical affairs does is we help educate HCPs, we understand the landscape. Digital opinion leaders can, they need education too. So I think that's the obvious piece. And it improves patient care. I mean, all of us are in medical for one reason or the other. You've seen a lot of surveys and talked to people about this. More often than not, why are you in medical affairs? Why are you doing what you're doing? It all comes back to improving patient care. And so if digital opinion leaders are having an impact in that area, then most certainly medical should and almost has a responsibility to engage with these digital opinion leaders. I think the other thing is, there's a rush to be fast in this world sometimes, and there's a lot of misinformation that can be disseminated, maybe to be controversial, or maybe just because in the rush to be first. Some of these digital opinion leaders don't fully understand the data set before they're making comments about that. And we'll talk about motivation, I'm sure, during the podcast. But I think all of those are very important reasons for us to engage. And again, depending upon your therapeutic area, I happen to be in oncology and hematology. A lot of patients actually develop support networks as a result of listening and engaging on some of these sites and different channels to learn about their disease and what their next steps should be. So certainly we've got a lot to learn about this. I think pharma is behind a lot of other industries in understanding this space, but we're catching up quickly.
Yeah. And what would you say? So, what are some of the characteristics or behaviors, let's call it, that medical affairs teams should look for when identifying DOLs in their therapeutic area, in their space?
Yeah, not surprising to anybody on the podcast is going to be credentials. Like you need to look for academic credentials to give any bearing. I mean, any of us can have an opinion, right? But they should, certainly be. We would prefer these opinions be for people that are well trained and well versed in the therapeutic area that they're commenting around. And I think by and large they are. But again, third parties like our sponsor can help channel and filter some of those characteristics through that. I think the other things to look for are who are their followership. And are they other physicians? Are they patients? Are they advocacy groups? Are they, CBS News or, whatever your favorite news media outlet is? All of these things are, I think, extremely important. I think another characteristic to pay attention to is frequency. How often are they engaging in this way? Is it just around Congress time? Or are these people like yourself that have a podcast that's on a regular cadence that patients and physicians can really tap into and learn from on a regular basis? And then I think just like you're talking to somebody at a Congress or in a social situation, what's the extremeness of their views, right? I mean, we live in a day and age where extreme becomes almost the norm, right? I mean, it's just hard. And so are these people really out there just to create controversy and increase their viewership and followership because of some extreme views, because let's face it, extreme views get the headline sometimes. Or are they really looking to disseminate information in a more responsible way to care for patients? And then I think something that's extremely important for us to think about as a characteristic is, what are their needs? Do they want to engage with pharma? There's a lot of there's a lot of anti-pharma and biotech sentiment that exists out there. Some people just want to really poke the bear a bit. It'd be hard for a medical affairs team member, field medical person in particular, to engage with someone like that if they don't want to engage, and if they're one of their purpose to do the podcast is to stir the pot. So I think being mindful of all of that before you engage is certainly something that we should all pay attention to.
Yeah, as you're talking, it's a reminder that when you're looking at an online personality or brand, they're all unique in and of themselves. There's some good actors, there's some bad actors, there's controversial actors. So you really do, it becomes a process of vetting, just like anything else.
Yeah.
And some of it, there might be an entertainment factor. Like you said, there might actually just be an entertainment factor to it. So it's a matter of kind of really deciphering. Um, let's talk about like this platforms or tools for finding and assessing DOLs. Can you recommend any specific platforms?
Well, our sponsor certainly, is one of the better ones. There's a bunch of them out there. I don't think a week goes by where I'm not either through LinkedIn or through my email, someone reaching out to me to help me navigate the digital opinion leader water. So it's certainly out there. It's been really interesting, Tom, for me to watch how this has evolved. It's evolved into a very specific skill set in science and experts in this area. Whereas even 3, 4 years ago, when we first started hearing about all of this, it seemed that, at least on my teams, there was always seemed to be one person on the team that was really tech savvy and social
Yeah.
media savvy, who kind of took it upon his or herself to educate the rest of the team. And at that time, it was Twitter and creating Twitter deck, and sometimes people would leave those calls thinking, what is this person thinking? I mean, this is crazy. This is not how we do things in medical affairs, right? And now it really is a big part of how we do things in medical affairs. So that's been a an evolution. And then you look at Doximity, you look at whatever your favorite or least favorite social media outlet is, and I see things on Spotify all the time on this. YouTube is very active with posting, and then honestly, at congresses now you see a lot of the top posters. When I say posters, I mean people that post information or that tweet information during the Congress using hashtag ASCO or ASH or whatever Congress you're at. And you see, as you walk around sometimes, they'll even have a leaderboard. So it encourages the behavior a little bit. I think it's a really interesting mix of a traditional way to receive and disseminate information at a Congress like American Heart or ASCO or whatever therapeutic area that you're in, that they're looking to say, hey, we know that people are posting about this, and some of them aren't even at the Congress. Some of them can be watching the Congress virtually, but yet they're using the hashtag and posting and capturing their comments in that way. So that's been, I think, super interesting. I don't know, how are you looking at this stuff? I mean, you keep abreast of digital opinion leaders. Any particular tools that you're using or that you use as an entrepreneur?
Yeah, well, I could tell you that, first of all, we are in a time of digital relevancy, meaning you have to be digitally savvy.
Yeah.
You just have to be, whether you're an entrepreneur, a business owner, recruiter, an MSL, a medical affairs leader, anybody that's listening to this. We are in a time where you need to be digitally savvy. I personally think that it's important to be diversified in your approach, but fine, because here's the thing: you need to be where your customers are.
Yeah.
You need to meet your customers where they live. That's actually a quote from somebody that was on this podcast. Shout out to Jason DeMuth, who we were talking actually about DOLs. And you don't know what platform of choice might be for your main customers. It may be Twitter. It may be YouTube. It might be LinkedIn. There's so many. You mentioned a bunch of them. There's so many different platforms now to pay attention to. One of the things that I would recommend is go back. I did a podcast on social listening recently. And definitely check out Medical Watch, because that's what they do. They're going to give you this information and you're going to be able to find it. So you don't have to curate it yourself. So that's one really good hack. But you need to be in the right place, finding the right information, learning what you can, and then utilizing that strategically.
It's such a good point you bring up, Tom. And let's face it, chances are to be digital savvy means you have to probably be on more than one digital platform at a time too. And who amongst us has time to keep track of all of those, which is why Medical Watch and people like that are so really beneficial in this space to do that work for you, so you can see the output of it rather than spending hours of your time, bopping from one platform to the next, seeing what's happening. So yeah, they're providing a great service for us that have certainly this as part of their job, but not the main component of our job in medical.
Yeah. And what do you see as the biggest mistakes that medical affairs professionals are making when trying to engage with DOLs? Or is one of the biggest mistakes not engaging?
Yeah, I think that's the biggest one, is ignoring the opportunity and the influence that digital opinion leaders have. It's vast, and it's reaching airways and public and private listeners that are really hard. I think there's several other things that I've seen as this has evolved too. Medical's not the only one watching this space, right? So we all have to learn the ways of working within our own company, and that includes looking at internally with, let's face it, there's a lot of compliance rules around how you engage. What materials do you use to engage? How do you speak to these folks? Marketing is in this space too, right? Because they've got a brand and they're working on brand awareness. They've got a digital strategy. Corporate comms or corporate communications has a strategy, and all the farm is trying to figure out an omni-channel strategy, right? I mean, we've all heard about omni-channel. Frequently talked about, seldom understood by most of us, but it's certainly a big part of budgets now in medical and marketing and the rest. And then again, there's different digital opinion leaders for different purposes. Some are educators, some are more on the advocacy side, some are more geared towards reviewing, academic publications and things of that nature. So I think that's something to be mindful of. And also, when you're, and you know this better than I, when you're working as a digital savvy professional, your needs are different. I mean, you need information that is easily distilled and easily communicated. And sending a digital opinion leader a 50 slide deck presentation on your brand or on your data is probably not the best way to meet his or her needs in terms of how they're going to be disseminating and communicating that information. And then I think the other thing too is this is such a rapidly evolving space. You have to review this a lot, and again, more reason to use Medical Watch or vendors like them to keep abreast of this, because it's changing. Not on a yearly basis, but only almost monthly to monthly. There are new players that are popping in. And then I think, again, ignoring misinformation. I mean, there's so much misinformation that is out there that needs to be corrected. And again, if in medical, if we're here for the betterment of patient care, we owe it to our patients that we serve to make sure that misinformation gets corrected as quickly as possible, either through the person or persons that portrayed that information inaccurately, or on our own, just to make sure that that's getting out there. So I think those are the biggest mistakes. I've certainly made a few of them. So I'm speaking a bit from from experience here, Tom. But yeah, I think that covers the majority of what I could think of anyway.
Yeah. And I'll add that, and I don't know how much this ties into it, but I think one of the, and maybe it's a mistake or maybe it's a little underplayed, is not utilizing AI tools enough. I think everybody's kind of dabbling and trying to figure out their way, whether it's ChatGPT, Copilot. There's some strategic initiatives from organizations that are, starting to really introduce AI tools in practical, applications for the day to day. But I think that not embracing it and not utilizing it, especially as it relates to understanding your KOLs or DOLs or finding, putting the information together, I think is a mistake, because I really feel like there's so many really awesome AI tools out there that can help cut down on the amount of time it takes to do some of this stuff.
Yeah, it's a wonderful point that you make. And I think the other, consideration here is that what digital opinion leaders are putting out there in terms of content in an open source AI model is going to get picked up by artificial intelligence, right?
Right.
And so it actually magnifies the effects of information or misinformation that they may be creating.
1,000%. Yeah. Which leads me to, because this is the key question here, is how should an MSL or a medical affairs professional authentically approach a DOL for the first time?
I touched on it just a minute ago. First, understand the landscape and the rules of engagement with your company and figure out who else is in the space. And of course, compliance is always on the forefront of our mind too. So understand the rules of engagement before you engage. I think that's underscored big, bold letters with flashing lights underscored in yellow. Okay, that's got to be the first step, is understand that. And then, you need to understand the motivations. Almost like a key opinion leader interaction, you wouldn't go in there cold. You wouldn't go in there and just start asking questions. You would have to understand the KOL. MSLs are so very good at what are their research interests, what are their publications, where are they speaking, all of that, and just the digital equivalent of that. What have they posted? What's been their motivations? What's been the tone of the, again, are they provocateurs, or are they medical education? Are they more patient friendly and focused? I think all of that is interesting. I think the other thing that occurs to me is, most academics, when you go in and say that you're a medical science liaison, they know what that means and they know how to engage with you. Digital opinion leaders probably have very little, oftentimes, idea what an MSL does. Are you from sales? Are you from marketing? Are you market access? Are you corporate communication? So explaining who you are, where you sit in the organization, and what your goals are, I think will build some credibility. And you used a great word too that I had thought of immediately too, which is authentic. Be your authentic medical self, right? I think that really buys you some credibility. You're not there to basically expand the brand or grow market share, but you're there to make sure that information is correct and understood, and that people can make their own informed decisions and say what they like afterwards, but with knowledge and facts at the basis of what they're doing. And then I think, I'm not a digital opinion leader, don't play one on TV, but I would imagine that most of them want to have independence. Like, they don't want to be a shrill for a company. They're doing this for reasons not aligned with marketing your brand or working for a pharmaceutical company. So understand that they need to be seen and addressed as unbiased and independent thinkers, just like you would a key opinion leader. And so do your homework, understand motivations, look at where they went to school. All of that is extremely important. And I'm guessing most of these folks, given that they're digital savvy, you can find a lot of this online pretty easily, because they're used to posting and communicating through that vehicle. So utilize that to your advantage.
Oh yeah, and I think that's mandatory as really the guiding light of how you should at least start and gain an understanding before you engage. But everything you say, and the reason I use the word authentic is because in this day and age, I think that works. I think people respond to authenticity um, way more now because we're in this digital space and everybody's out there, and it's so important to have your own brand um, and to carry it well and be confident. But the thing that I worry about, and let's talk about engagement, and what types of content or interactions are appropriate or inappropriate for MSLs when they engage with DOLs online.
Yeah, I think, and again, it's really important to understand rules of engagement, and you know how MSLs usually have things that are approved for training,
Mhm.
for showing, or for dissemination, and it's important to know what bucket you're in, because look, these things could end up like when you work with a KOL, something might end up on a screen at a congress. When you're working with a digital opinion leader, it could end up on YouTube, right? And so
Mhm.
you certainly don't want your compliance officer waking up to something that's not approved for use with a digital opinion leader on a very public forum. So be extremely mindful of that. And again, I think for content, I think conversation first. I would say that it's really good to get to know someone before you bring out the slide deck and start showing data and Kaplan-Meier curves or adverse event tables. You got to get to know them and partner with them and understand those motivations first. Um, and then, medical leadership. I think you have to make sure that everybody within your chain of command and in other areas are on board with what you're doing. So don't make it a secret mission. Make it a very public mission that you're going to be engaging, and let medical affairs leadership know, marketing understand that you're in there, corporate comms, because this person might be engaging with 3 or 4 people in your company and you may not even be aware of it, right? There's a lot of people fighting for time there. But I think medical really deserves a spot towards the front of that line with the content and with the information that we have to share in the unbiased way that we engage.
Yeah. And let's talk about some guardrails. I'm sure there's got to be best practices for companies, and there's got to be stuff that's already in place for DOL engagement to make sure that MSLs are staying safe in their engagement. Can you talk a little bit about those?
Yeah, maybe. And maybe this is just me being a little slow to the party, Tom. I don't know, but I was mentioning I was at a internal meeting this week, and I sat next to our executive director of scientific communications, and one of the things that we were chatting about over coffee was how we need as an organization to better understand the motivations and what these folks want. So we're talking about doing a digital opinion leader virtual asynchronous ad board to understand those kinds of things. So I'm sure that there are companies that are further along, and probably several that are not as far along. We're probably right in the middle, but we certainly recognize the need to better understand this space. And I think something in terms of guardrails, just use your emotional intelligence and seek first to understand, and that's why I think conversation first is so important here. I think the guardrails that you want to avoid are just going in there and being viewed as someone that doesn't understand what they're doing and their content and what's happening, and trying to force a narrative or tools on them that they may or may not need. So I think it's just basic good manners, and a little common sense mixed in with some emotional intelligence, and then underscore again in bright lights that know the landscape of your company and who else may be engaging with them. And if you got all that right, I think you're on pretty safe ground. But tread carefully, because that could change at any moment.
Yeah, for sure. Yeah. And, I'm curious, this isn't the first episode that I've done on DOLs, but since I've been doing this, things have changed and evolved so much. And this digital world has just expanded. And we talked a lot about that earlier. And where do you see it going? Like, what happens in the next 3 to 5 years?
Well, I think you can go. Let's approach that first from I think companies are going to invest more in this space. I think everyone recognizes that, your previous guest had it right. My grandfather would say, "Fish where the fish are." Right? You got to be where people, or fish in that case, are congregated. Throwing a line in a pond that has no fish in it does not yield good results. So we understand there's a lot of fish right now, and there's a lot of different
Mhm.
ponds to go exploring in them. So are looking for them in. So that I think that's really important, and understand that investment usually follows opportunity, and pharma is figuring this out. So watch that space. I also think that FDA is watching this space very carefully, and so from a regulatory standpoint, I think we're going to see more and more guardrails on what gets posted, and maybe even, and I mentioned earlier the amount of misinformation. CBS News was saying there's more misinformation than valid information um, on the internet, and that doesn't surprise many of us. So what can we do as a government, as taxpayers? What can our government do for us to try to clean that up a bit? Right? No one wants misinformation that's out there. It doesn't help anyone. And then I think too, I think consumers will become more savvy. And by consumers, I mean patients and caregivers and healthcare authorities. Like, you need to know the source. You need to check the source out. Be aware of their credentials. Caveat emptor, buyer beware on what you're consuming. And you've got big decisions to make on your health. You better be very careful. It's funny to me sometimes people read labels in the grocery store, but then they'll be quoting stuff they heard on the internet to me, and I'm like, you have no idea who that person was, but you know every chemical in your dairy creamer that goes in your coffee, right? And so I think we need to be mindful of both, but put some of those practices into place. So more investment, more regulation, more savviness, and then let's just be prepared for digital and other channels to increase in their likelihood of impact and influence. It's only going to grow. I don't see it shrinking. How about
Yeah.
you?
Yeah, no, and it's so funny you talk about the misinformation piece, because in one sense we're saying get out there and listen and be savvy and all these things, and then we're like, but make sure you make sure you know what you're learning. Make sure that you get this accuracy of information, and I think that it really does require the individual to be super thorough in their process. I think that this really requires and I don't want to keep using the word savviness, but I think you do have to use discernment when you're out there and you're curating the information, and how you're going to use it, and just to be super careful and double and triple check. But I do think that the good news is that there are a lot of reputable sources, tools, like we've talked about throughout this episode, that can help you with this, to keep you on track and to make sure that you're not making any mistakes.
Yeah, I think you're right. And the other, I always think it's interesting whenever I see anything posted, the comments are always so interesting too. And
Oh
I
yeah.
think it's part of savviness is looking at what's the reaction to the data that you're seeing on a digital channel. What are people saying about it,
Yeah.
and who are those folks? Like oftentimes you'll see physicians correcting other physicians or other patients that are weighing in on information. So don't just read the headline, dig into the comments and really educate on the response. And if the response is not overly favorable, be super super critical yourself as to how you're processing it, and look for those credentials in the comment sections too.
Yeah, that's great advice. What would you say? So, last question, what would you say to somebody if there's like one thing you could say to somebody that's like, hey, I listened to this podcast. I got to do a better job with my DOLs, and I got to get out there and start, becoming a digital first MSL. What would be the one piece of advice you would have for that person?
Yeah, I think as a first step and the first piece of advice is get some help here. I mean, we talked about how many channels there are and how much, none of us can do this alone. So Medical Watch, thank you for sponsoring. I think, trying to do this without a third party to guide you is a little bit trying to navigate the internet without a search engine. I mean, I think it's almost malpractice to begin it without some professional help at this point in time. And then partner with them because, the third parties are oftentimes way ahead of us in pharma as to where this is going. And as we talked about at the beginning of the podcast, they've got time and expertise to do it. This is no longer something you can do as a hobby or a pet project, or have that one person on the team that's, looking out for digital opinion leaders and filling us in the 5 minutes at the end of a team call. This is big responsibility for medical to get right. And for all the reasons that we've talked about, not to do it wrong and to understand the scope and influence that digital opinion leaders have. So I think that's how I would answer your question.
Let's leave it there, man. That's it. I totally agree that digital is here. Like, you need to embrace it. And just jump in, man. And I think you're gonna be able to stay with the curve, because it's not going anywhere. So, Paul, as always, you're the best, brother. I really appreciate you coming on. And this was like the fastest, like, I don't know, 30, 40 minutes of my entire week talking to you, brother.
Well, I look forward to seeing you soon, and I'll be doing all the summer circuits like you will. We'll bump into each other soon. Always look forward to it. And again, thanks for your great work educating all of us in field medical on all these topics. It's just super. Keep it up, Tom.
Thanks, Paul. Appreciate you. I'll see you at ASCO.
All right, look forward to it. Thanks, Tom.
Thanks, guys. Appreciate all your support. And if you got value in this, please share this with others. And we'll see you next time.